go to number 7. Number 7 is a meeting point between chronic conditions and management. So this is what I say. I call box 7 managing long-term illnesses. Managing long-term illnesses. How many questions should you expect? Based on the way the questions have been set and have been distributed, I'm expecting about 23 to 25 questions. So averagely 24, where you are going to look at, okay, a patient has chronic medical conditions. How am I going to titrate their medications? How am I going to increase their medication doses? How am I going to cut down on the medications? Maybe if I'm over-treating that particular condition, what are the side effects of the medications I'm providing? What are the parameters I'm going to use to monitor this patient's chronic medical condition? So what are the things I'm going to study if I'm dealing with box 7? Number 1, guidelines for long-term control of medical conditions. So guidelines for long-term hypertension management, type 2 diabetes, hypertension management, as well as I'm going to learn the target goals. So if you have a patient with diabetes, what's the target blood pressure? What's the target HbA1c? What's the target LDL? Right? And what is my follow-up schedule for these patients? So what tactic am I going to use? I'm going to learn how to master continuity of care. And I'm also going to balance, treatment algorithms with side effects of medications. So box 7, nail. Let's go to box 8. Box 8 is how to help patients with mental health conditions. So I label box 8 as helping with mental health. And with the distribution of questions out of the 230 and the percentages, I'm going to expect about 12 questions. That's 12 to 13. So this is where I'm going to look at how am I going to select mental health medications like SSRIs, like antipsychotics. When am I going to use first-line antipsychotics? When am I going to use second-line antipsychotics? When am I going to augment antipsychotic use? When am I going to change from a particular SSRI to a particular SSRI to another SSRI, or from SSRI to SNRI? And if I'm switching, how do I switch? When am I going to use a MAO inhibitor, for example? Okay, when am I going to use psychotherapy? When am I going to refer a patient to substance use programs?